While this COVID pandemic has devastated the lives of many people in this country, and it has perhaps affected people living with disabilities more than any other group in this country because of the segregation of our society. The severity of the devastation of COVID-19 amongst people with disabilities is evidenced by the effect of COVID-19 on the nursing home population. Congregate living facilities like nursing homes, facilities that those people with disabilities in favor of community integration have long fought to close, have to a large extent driven the spread of the pandemic. More evidence of the severity of the COVID-19 pandemic to people with disabilities was recently reported in the New England Journal of Medicine. And it says, quote, a study across 547 US healthcare organizations finds that individuals with intellectual disabilities are at substantially increased risk for dying from COVID-19. Now, in some significant ways, there are parallels between effects that the COVID-19 pandemic has had on all of us in society and the effects of disability can have on people with disabilities. Consider the lockdown. During the lockdown, many people felt restricted to their homes. This has been a frustration for some people, even with disabilities, even long before the pandemic. During the lockdown, quite a bit of business and even personal interactions were conducted via video or phone chat. In this way, all our personal restrictions were limited or restricted. This is how some people with disabilities always interact with most all others. During this pandemic, many people have been required to follow mask mandates and found it difficult to read others because we couldn't see their faces completely. I have been told that this inability to read others' emotions is sometimes a marker of an autistic spectrum disorder, or ASD. Many people with ASD have difficulty reading facial expressions and body language. Much like what we've all found as a result of wearing face masks, many people with ASD find it hard to interpret and or respond to other people's feelings. So in a way, COVID has leveled the playing field because the challenges imposed on everyone are similar to some of the challenges imposed by different disabilities and our society's architectural and attitudinal barriers. The frustration many have felt as a result of this pandemic may be similar to the frustrations that some people who live with disabilities always have. One important difference is that as more and more people become inoculated against the coronavirus, and as our fears are reasonably lessened, many of us can relax into a less fearful and less constricted lifestyle. However, this is never possible for many people who are restricted considerably by disability and by our society's restrictive expectations, efforts, and hopes of them. Yet, some societal changes wrought by the COVID-19 pandemic have, unwittingly, actually advanced causes fought for by people with disabilities for decades. These cultural shifts have enabled the further integration of people with disabilities into the mainstream. The right to work from home, the access to telehealth appointments when office encounters are unnecessary, and especially the right to insurance coverage for home healthcare services, in which most cases reduces the total expense billed to insurance companies and relieves the pressure on hospitals during this pandemic. It saves the clients money and increases their quality of life as well. A significant fraction of the congregation listening to this service are joining us online. Many people can now do this at other churches as well. This ability was installed, at this church at least, in response to the pandemic. Enjoying services online helps churches reach out to those distanced or unable to attend the church for other reasons. Thus, because of one of this church's responses to the pandemic, we can include members with disabilities or particular neurological needs to a greater extent and more easily invite a wider group to attend church with us. In this way, we are more truly becoming accessible to all. Because of this pandemic, my friend Kelly has also been able to enjoy adaptive yoga classes online. Many more stores have developed service option of delivering their products to our houses as a result of the pandemic. What are now almost cultural norms were previously unavailable or very hard to come by. There are other gifts of the pandemic. Because of our disabilities and the pandemic, both Kelly and I have slowed down the pace of our lives. Have you found the ability to slow down your life helpful as well? Because of the pandemic, we have seen the increased acceptance and sometimes requirement of working from home, a possibility long advocated for by people living with disabilities. I bet some of you have enjoyed not having to commute to work for this last year. Because of COVID-19, Americans seem to be expressing more clearly compassion towards others who found themselves in humbled positions. I've heard stories of neighbors supporting and assisting unknown neighbors. Have you tried to reach out and to help others more, even if remotely, because of this pandemic? I wonder how we can make these effects permanent in developed nations, those nations lucky enough to have healthcare infrastructure enabling widespread vaccinations, and as people begin to return to more pre-pandemic cultural norms. People with disabilities are like canaries in coal mines. Just think of how much more prepared for the pandemic our country would have been if the voices of people with disabilities asking for accessibility and accommodations had been heeded when their request was clearly voiced. How can we learn from people living with disabilities whose adaptable skills and nature was developed because of their particular challenge? We can start by welcoming them into our lives, hearing and responding to what they have to say. Listening to people with disabilities and learning their perspective can, perhaps, help us develop the wisdom of Solomon.